It's Wellness Nerd Out time! How you guys doing tonight? Happy Wellness Nerd Out time, you guys. And today we are going to be talking about the treatment for diabetes. Diet, lifestyle changes, who you should be seeing, how often, things like that. But before we get into it, I want to say happy birthday, Zach Finch! Happy birthday, dude! This one is absolutely for you, my man. We'll talk about him a little bit more at the end. But as for now, let's get into our discussion for the day with diabetic treatment. So when we talk about type 1 diabetes, we know that the major problem is that we have that autoimmune attack on the beta cells, reduced insulin sensitivity of the receptors, right? We talk about that and, issues with releasing insulin in type 2, more so things like that, right? But when we talk about type 1, the big thing is that we get them more insulin, all right? So that's top. They need to see doctors too, but that's the big thing first off. When we talk about type 2, albeit you could be on medications, you could be doing diet and lifestyle changes that should be helping, but maybe they're not, then we might need to give them insulin as well. But let's talk about who we should be seeing in general. All right, so with diabetes, even for type 1 diabetics, even though the major problem is that they just need more insulin, right? It's not because of the metabolic syndrome, right, that we see causing type 2 diabetes with poor diet and lifestyle, right? Even the people with type 1 need to see a podiatrist or a foot doctor annually, all right, at least once a year, but they can start 5 years after the diagnosis, all right, so long as they are taking insulin regularly. When we talk about type 2 and diabetes in general, we should be seeing, again, that podiatrist at least once a year. We should be seeing an ophthalmologist because we can have eye issues, right? You have so many, there's a wide range, right, of different problems we can get with diabetes. We talked about all of them yesterday, just about, right? And so it's important to see an eye doctor at least once a year as well. What we also need to do, it's not just specialty doctors. You need to see your general doctor, your PCP, at least twice a year if you have diabetes, all right? And on top of that, we should be checking our kidney function. We should be checking our kidney function at least once a year because we know that we could get chronic kidney disease from diabetes, right? And we know that we may be peeing too much albumin out in the urine, right? Excreting albumin, we get that microalbuminuria, and things like that. And so it's important to check creatinine levels, blood urea nitrogen, and albumin levels frequently, at least once a year, all right, if you're a diabetic. Now, on top of that, we want to check our HbA1c levels. And these are going to be more frequent checkups than the aforementioned because, when we talk about the diagnosis of diabetes and we talk about HbA1c, it's 6.5% or greater, right, giving us that diagnosis along with the presence of other signs and symptoms, right? And so if you have around 7%, I should say pretty much at 7% HbA1c, then it's pretty well controlled, right? Is the glucose binding to hemoglobin in the red blood cells, which is the HbA1c, right? The percentage of that happening, right? And so if it's 7% or less, you could get it checked on every 6 months, all right? But if it is higher than 7% and not as well controlled, you're going to check your HbA1c levels, your percentage, that is, at least once every 3 months, right? And we do that because why? The lifespan of a red blood cell is 3 months, the average lifespan, right? All right. So when we talk about thank you guys for tuning in. We'll get to you in a second here. I can't see you yet. When we talk about some diet and lifestyle changes, well, and especially with type 2 here, metabolic syndrome being the primary cause, right? It's important to get high intensity exercise in. It's important to do high intensity exercise where you are having difficulty breathing, catching your breath, where you are dripping sweat, working real hard for, if your goal, even if you're somebody that doesn't work out often, your goal could be to do this for 30 minutes in a whole day, just 30 minutes, all right? You're worth it. You could do that. You do it for 30 minutes, and if you could do it most days of the week, so at least 4, that would be all right. But, more would be better, obviously, so long as, you have ample rest and you're not doing anything that's going to hurt yourself, right? So that's high intensity exercise. You're going to cut out smoking. You're going to cut out drinking. That is for damn sure, right? As you pretty much should just about do anyway, right? Wide range of problems, And when we talk about metabolic syndrome, we said one of the things we get is atherosclerotic plaques, right? And so it makes sense with the smoking and, things like that. But on top of that, you don't want to be stressed. You don't want to be stressed when you have diabetes. So you have to do stress relieving activities, whether it's a non-stressful hobby, right? Whether it's deep breathing or it's yoga, things like that. You got to keep your stress levels low. So when we talk about food, what kind of food are we thinking? All right. Well, yeah, the problem is we have high blood sugar, all right, and diabetes, and we can't absorb it into the cells properly, right? Because we have malfunction or insulin or not enough, right? Or things like that. And so, yeah, you would think, all right, I don't want sugar. And yeah, you could still have a few carbs, but if you're gonna have carbs, you make them in moderation, and you have all natural sources of carbs that are high in soluble fiber, because that soluble fiber will feed your gut microbiome, your gut bacteria, helping you break everything else down, right? And so it's very important to feed the gut microbiome and to just have all natural carbs in general, all right? And you're looking at things like beans, lentils, legumes, dark leafy greens, vegetables, right? Fruits, berries, whole grains, right? Now, when we talk about protein, you're looking at your lean meats, your lean chicken breasts, your lean pork chops, right? Fish and other seafood and shellfish and eggs are another great source of protein. Now, when we talk about fats, you don't want too much fat either, just like you don't want too much sugar. But if you're gonna, when you're better off having more fats than sugar as an energy source, right? And so, of course, right, you don't want that high blood sugar, right? We want to, make our insulin not work as hard. We want to improve insulin sensitivity over time, right? And and especially in type 2. And so, when we talk about these fats, nuts, seeds, you can have fish, right? Again, like salmon, extra virgin olive oil, avocados, right? And things like that. So, those are a few tweaks and treatment for diabetes, my friends. And we didn't mention medications because we talk about all natural remedies here at One Wellness and the holistic approach, doing our best in conservative treatment before we have to get there, all right? But, again, if these diet and lifestyle changes aren't enough, we have said, you might need some medication, or you need to actually get on yourself and get these diet and lifestyle changes in gear, because that's probably really what's going on, right? If they're not working. But, at the end of the day, we want you to have low blood sugar and to be healthy, right? So whatever it takes. B-Bays, what's up? MV Dillard, how you doing? Danny Adelo, my man. Danny Kip, what's up? Leo Skux, how you doing, baby? Thank you. What's up, Nikki? Rachie Friedman and Parker. What's up, brother? How you doing, man? All right. Thank you guys very much. Before we go, we are going to talk about Zach Finch, because it's your birthday. Happy birthday, Zach. Oh, man, dude. I hope you're having an awesome day, man. I hope you had a great day. Hope you're having a fantastic night. You're probably kicking it, chilling with the family. You're a family man now. Respect that, But I'm sure you're enjoying it and loving life as you always have, man. Zach, real bright guy. Always crushing school. Picked up rugby real quick. Great athlete and just, natural and those types of great qualities you have, and being just a great guy and great athlete and a great mindset in general and academics and things like that will translate to the rest of your life. And you're going to live a great one, my friend, so long as you don't change yourself, because you have a great self as of now. And I want you to know 100% that this one is for you, my brother. So happy birthday once again. Thank you guys very much. We'll see you tomorrow. Happy When Wellness. Have a great rest of your night. Thank you.